Good morning, Mrs. Carter. My name is Lucia, and I'm going to be your student nurse today. I'm just here to give you some of your medications. Are you ready to take some of these? Okay, perfect. So today I will be giving you nitroglycerin. You might have also heard it called nitro, for the chest pain that you've been having. Have you ever taken this medication before? No? Okay, I just want to go over a couple key details for this medication before I give it to you. So as I mentioned before, excuse me, nitro is for the chest pain that you've been experiencing. It's going to open up the blood vessels in your heart and allow for more blood to reach your heart, which should decrease some of the pain that you've been having. Before I give you this medication, I just want to double check that you don't have an allergy. So just to confirm, to your knowledge, you've never had an allergic reaction to nitro or nitroglycerin before, correct? Okay, great. Now we can move on. So before I get into the details, do you take any other medications at the moment? No. Okay, wonderful. Before you take this medication, I just want to make sure that you know some of the important details. So because we are opening up those blood vessels so that more blood can reach your heart, sometimes we have patients that experience low blood pressure. You would feel this through dizziness. You might get a really bad headache or feel kind of woozy when you stand up from seated. So because of that, while you're taking this medication, I want to make sure that you're staying careful when you're moving around, especially when you're standing up from seated, whether that be like out of bed or from the toilet or that kind of thing. While you're staying with us, I want to make sure that you're using your call light. So if you have anything that you need, anything that you would need to get out of bed for, please just let me or another nurse know using your call light, and we'd be more than happy to come and assist you, just to make sure that you are not taking any falls or experiencing any fainting or anything like that. Additionally, some patients do have an intense headache that can come along. So just please keep us posted on if that starts to happen. We'd be happy to give you some Tylenol or just some like light pain relievers to help you with that discomfort that you're feeling, okay? Okay, perfect. And then because of the potential side effect of really low blood pressure, I'm going to make sure to take your blood pressure pretty regularly. So you're going to be getting that cuff on you probably every hour while you're on this medication, just so that we can keep an eye on your blood pressure, make sure that it's not crashing. Additionally, if you experience any loss of consciousness or fainting, please tell me or another nurse as soon as possible. This can indicate that you are not tolerating the drug well. And then also, if you get any itching, any rashes, swelling of your mouth or your throat, please let us know right away, as you could be having an allergic reaction. If you still feel this chest pain in a couple hours, please let me know. We can give you a couple more doses of the nitro, but if it continues to not work, then that could be a sign that your blood is still not getting to the heart, and we might need to try a different medication. Either way, I'm going to be hanging out with you for 15 to 30 minutes just to keep an eye on you, monitor your blood pressure, and make sure that you're tolerating the drug well, okay? Any questions for me? No? Okay, wonderful. All right, well, I'm going to go grab that nitro for you, and hopefully we're going to take care of that chest pain you've been having, okay? Okay, great. All right, I'll see you in a little bit.